Hi, I'm Sylvia Burgos Toffness, and this is Deep Roots Radio, the Face to Face edition. This show trains a spotlight on the connections between what we eat and how it's grown because every dollar you spend on food or clothing, lumber or healthcare products can either help or hurt the environment. What you buy promotes humane livestock management or perpetuates harmful conditions. Your purchases can also help farmers make a living wage or continually struggle to make ends meet. Every guest brings knowledge and experience and perspectives that illustrate the linkages between farming practice and health, the health of the land, livestock, we humans, and our economy. My guests come from all across the country and around the world. They describe efforts that point us to more vital and just systems. I hope you enjoy this interview. And I am so glad to have with me today Dr. Anne Stobart. She is a trained and highly experienced clinical herbalist, a designer and implementer of permaculture in the way of medicinal forests. She is host to hundreds of visitors and a teacher and a blogger. She also is the author of 3 books so far. Household Medicine in 17th Century England, that's one. The Medicinal Forest Garden Handbook, and her latest book, Trees and Shrubs That Heal. And we're looking at the medicinal trees and shrubs of the UK. Tell me, what is available? What have you used there where you are?
So, as a clinical herbal practitioner, I've had maybe 120 different herbal tinctures on the shelf. So it's always quite hard to pick out individuals. And of those, I suppose maybe I'm trying to think now. Maybe a third could be harvested in this country, although I've increased that number by trying out other things. And many of the things, so this is a long answer to your question, but many of the things are probably familiar. So things like hawthorn and the like, and willow and so on, probably very familiar to listeners in Northern America. Um, so uh, and possibly would do similar things. So although I might pick them out as species that are native in Europe and the UK, there probably are equivalents where you are. But one of the ones that has to be mentioned is hawthorn, because there's a lot of research and there's a lot of it growing here. You would think that as a result, it would be much more widely known and better used. But ironically, many supplies of hawthorn are based on imported berries and imported tinctures. And that's one of the reasons I started growing my own, was
So
because
let me ask you this then, Anne. Hawthorn, there's a lot of it in the United States, as you so well put. Um, People do not recognize hawthorn in this area where I live. They don't know that they have it. They wouldn't recognize it until I point it out. Although it's growing everywhere. I think it's a very much unrecognized and underappreciated scraggly tree or shrub, however you want to call it. It is just beautiful. I was amazed and delighted when I was traveling in the UK and just came across. I was happening to be there in May and happened to enjoy the blooming of hawthorn where you are. So you're growing it on your own. How long does it take to grow hawthorn that you can actually harvest?
well, that's a good question. So it's in the rose family. So it's one of the many fruiting trees and shrubs in the rose family. And they're all notorious, really, amongst herbalists for the tannin astringency content, and also for the useful phenolics, the anti-inflammatory contents. And you can get those particularly in the fruits, as we know, fruit is good for you. Some fruits, particularly the purpley, reddish, darkish ones, are really good for you. But those many of those constituents are also in the leaves and the flowers. So when you say how long does it take, some of the shrubs in the rose family will start fruiting and flowering almost straight away within a few years. Hawthorn and other plants, once they've started flowering, they will flower every year on previously matured branches. So what that means is that in this country we have masses of hawthorn hedges, because hawthorn's so, as you say, scraggly and prickly. It makes a very good hedge plant, and it can be grown from cuttings very, very cheaply and easily to make hedges. But of course, what happens is that farmers here, they cut these hedges every year, usually, and so we don't often get to see the flowers in the hedges unless the branches are out of reach of the flail cutters. So I've always thought this is a very odd situation, because we could have a fantastic hawthorn berry harvest if only we would cut hedges every other year on each side, if that makes sense.
Ah, I was wondering about that. I was wondering about that when you said that a lot of it is imported. That's
Mm,
why.
mm. Yes, and hawthorn is quite, I mean, it can be quite difficult to manage. I remember when we first purchased our woodland site, on one border, it was all Sitka spruce, but on one border, there was a hawthorn tree that had somehow got in there and survived. And so it's quite well established. It was probably 20 or 30 years old. So we chopped it right down. And the following year, about 1,000 prickly shoots sprang from the stump. I mean, it was completely unmanageable and impenetrable. And so unless you've got really good thick gloves and the like, it's quite difficult to get in there. So
Now you said that this was highly researched. So what is it that has been confirmed through research?
okay, so the problem the problem with research is that there's not really much incentive for pharmaceutical research unless you can patent the medicines that come out of it. And of course, patenting plants, you can probably get away with patenting preparations or extracts, but not a plant as such. So the amount of research that's done is mainly done on extracts of hawthorn, particularly of hawthorn berries, and the research is limited on, if you like, clinical subjects, real patients.
Mm.
Uh, Again, because of the issues around profits and the like. But in general, hawthorn is extremely beneficial for heart health, for the circulation. So it's not just things like vitamin C, which we know is good for the circulation, but also anti-inflammatory constituents, flavonoids and the like. In fact, hawthorn is so reliable in benefiting the circulation that it can both lower blood pressure, it can strengthen the heart if you need to lower blood pressure, but it can also raise it by strengthening the heart if it needs to be raised. And as a herbalist, I would not advise anybody to take hawthorn if they are taking blood pressure medication, because the twin effect of both the orthodox drugs and the hawthorn would probably be too much.
Mm.
It should only be done, should only be taken on medical advice, and possibly not. Um, there's no way that anybody should be doing it on their own without medical help and backup.
And
But
that
yeah,
is if they're taking other medication.
absolutely, yes.
Ah.
It's not advisable in my book. I think, problems with blood pressure
Mhm.
and heart problems need to be treated by people who are medically qualified, perhaps in consultation with a herbal practitioner.
Mm. So what other trees and shrubs do you tend to use or have been used historically in the UK?
So there, there are probably the ones that are most well known are the willows,
Hmm.
and because of the long tradition of using willow as a painkiller, because of the salicylate content, salicylic acid acts as an anti-inflammatory, and so that's another one that's well known, possibly less well researched, although there is enough evidence to justify, for example, a European recommendation that willow can be used for helping back pain, for example,
Mm.
as an anti-inflammatory. So that's another one that's worth bearing in mind. But there are some plants which grow really well here, which are European, which are not really appearing in the historical records. For example, Gilderose, crampbark, which I think we've talked about previously,
Hmm.
and it's quite surprising to me that it's not been particularly mentioned in the folklore. So there's a kind of a curious mixture of plants, that species that have been observed to be really useful in certain ways, and others that haven't been picked up. And that may be to do with the way that people understood health in the past. More, not that they haven't been helpful, but they
Hmm.
haven't been noticed so much.
Now, what others have you kind of relied on? You mentioned that you've planted some in your medicinal forest, and perhaps had purchased tinctures from elsewhere.
So the rose family is a really good example because there's so many ground herbs as well as trees and shrubs, from little strawberries, for example. Strawberry leaves are wonderful because they're rich in tannins and highly astringent, right through to shrubs like brambles and raspberries. Um, People might think of them as weeds here, but the leaves are great in a tea, particularly can be used to make mixtures, and again, very astringent and anti-inflammatory, right up to perhaps there's a range of interesting fruiting trees, the mountain rowan, for example, which has
Mm.
plenty of fruit. I mean, we tend to think of fruit trees in the rose family as familiar apples and pears, but there are lots of other trees with berries. So that those are good examples. But there are other plant families. I mentioned the willows, so that's the birches and the aspens are all related to each other. The oak family, funnily enough, does appear in historical records because oak was used so widely for its tannin content. But that's, if you like, the wrong kind of tannins for medicinal use, and probably not advisable without careful use.
It's fine. What is your caution about the oaks? What is it about them that's different from the other kinds of tannins being pulled from other plants and trees?
So the condensed tannins in oak are, if you like, not quite so good for the digestive system, and indeed some of the other trees have, because of the bitterness. I mean, tannins probably were invented by trees to stop insects and nibbling creatures. So
Right.
so it isn't a surprise really that some tannins are not so beneficial for our digestive systems, and they can sort of, although they can help to line the stomach, they can also, the bitterness can be quite aggravating for the stomach. And indeed, that was one of the reasons that um, the willow, although it was used for helping with pain, there were alternatives sought, and it was European chemists that discovered aspirin, which is not a constituent of willow, but it's closely related to salicin or salicylic acid, which is in willow. So aspirin and willow, it's quite important really to know the distinction, because some of the effects of aspirin are irreversible, which is quite problematic. The number of illnesses and even deaths that can be caused by aspirin, because it causes uncontrolled bleeding in the stomach if it's allowed to affect the stomach wall. So although many of these plants had problems, they weren't necessarily, if they were understood better, they weren't necessarily going to be toxic.
Right. Well, you've mentioned the leaves being used from those shrubs and trees of the apple family.
Mm.
Um, are any of the barks also used? And was the fruit part of the herbal apothecary then?
Well, yes, indeed. I mean, the cherry trees are particularly well known for their bark. And here again, we got more examples of plant species learning to protect themselves, if you like, because the trees in the rose family, particularly the cherries, but some of the others, contain cyanogenic glycosides, or um, something equivalent to prussic acid, which is pretty toxic in very, very low quantities. That is antispasmodic. So, for example, cherry bark is used in making cough syrups because it helps to reduce a dry cough. But we only use it in a dry cough because we don't want to reduce a cough that should be bringing up phlegm. Again, I think sometimes important to know the nature of the complaint as well as the way in which the plant works. And those cyanogenic glycosides can be found in seeds too. So that's why we get the almond smell, and too many apple seeds not being very good for you.
So this the cyanide constituent is found in the bark as well as in the seed.
Yeah, it is. Yeah.
Well,
Mhm.
that's good to know. Yeah, I've got 3 cherry trees species on my farm. So I've got a commercial black cherry, a wild pin cherry, some wild pin cherries, as well as choke cherry.
Now choke cherries are a little bit different, possibly. If it's a choke, there are choke cherries and choke cherries. There are choke berries and choke cherries. If the choke cherry is an aronia, then there is edible fruit. But it is quite important to identify them. The cherry trees will have shiny bark with rings, and they'll all be usable. An infusion
Mhm.
can be made from the bark, and then that can be made into a syrup with maybe with other constituents that are beneficial for a cough. The choke berries are particularly good, I think, for making a fruit leather or something
Hmm.
along those lines.
Right. Yeah, around here it's a plant that's very much respected and revered because of those very, very tart choke
Mm.
berries, which are
Yeah,
mostly seed. You have
yeah.
to gather an awful lot of them to finally get the juice that you might need for making the highly prized choke cherry jelly.
Oh, lovely.
Yeah, yeah.
I'm a big fan of jellies. But we do have a lot of really wonderful shrubs here. We have black currants, we have gooseberries, raspberries, and so on. And most people wouldn't think of using the leaves, although they could be used to make astringent teas. So that's quite important. Raspberry leaves are used by um, uh, people for pregnancy, the
Mhm.
first trimester only, because they're said to be tonic or toning for uterine muscle. So, but of course that's probably true of many of the rose family, and we could be harvesting bramble leaves as well as raspberry leaves, even dog rose, which is a wonderful hedgerow plant that could be used for its leaves.
So when it comes to the brambles, I know that I've used uh, raspberry leaves. I didn't realize that the gooseberry also offered such beneficial constituents in its leaves. And I've been a big fan of gooseberries. I plant them wherever I go um, because of the fruit. And I tend to choose varieties that can be eaten out of hand. Not You don't have to make a jelly or jam. I did that for my children when they were little. I put gooseberries in so that they could go out and try to pull some gooseberries out of those thorny bushes. But I didn't realize the benefits in the leaves.
So I think it's worth experimenting a bit. When we used to run courses at Medicinal Woodland Project, which we sold during the pandemic, but we used to invite people in, and as we walked around showing people what was possible in terms of medicinal forest gardening, we would gather leaves literally, and encourage people to gather younger leaves, not sort of grotty old ones, and then we would get some water on to boil and do mixtures. And I've always felt that the idea, in fact, I think I'm writing this up in one of the courses online that I run, making a digestive tea from 3 types of species in the woodland was a great way to practice trying out these leaves. So one type needs to be a rose species for the astringency. So it could be the bramble or the rose or the gooseberry. The second constituent needs to be a digestive remedy, often a bitter taste. So it could be something like yarrow or something from the daisy family, often quite useful.
Mm.
Then the third ingredient would be something aromatic to give
Mm.
to give a bit more of a nice taste. Maybe a mint, something like that would go well. So then we would combine these together to make our own digestive teas. The important thing, of course, is to make a note of which ones you combine so that if you like it, then you can repeat it.
Got it. So you would tend to pick these and use these fresh?
Yeah, yeah. Obviously, if you get a nice combination, then it'd be possible to dry those leaves in a single layer in an airy place, and they would keep for up to 12 months.
Now, you've mentioned a number of shrubs and brambles and trees. Um, Historically, which were the ones that were used most often for common complaints? So
Oh,
things are, their digestive system, their joint pain. What would tend to be the things that people would use them most for?
so I think that probably most complaints would have been treated externally by chewing up leaves and or mashing them up and making them into poultices. So a lot of the wayside herbs would have been the ones that would have been used, like the dock and such like, possibly more so than um, the trees themselves. So it's difficult to pull out any one particular, and
Mm.
some of them would have been used like the elder leaves are quite a bit unpleasant really. Some of them would have been used because they were unpleasant and they would irritate, um, or,
Mm.
or not be so good. So it's a difficult one really um, to answer that specifically.
Oh, that's all right. There's a lot of herbs and a lot of complaints. And we all have to seem to do, and since the human body is frail, we all become susceptible to
Sure.
some kind of pain and
Yeah,
issue as we go along. So when you think about the one of the things you mentioned in our previous conversation is that there are a good number of medicinal trees and shrubs in the UK and a really extensive number in the United States, which may be because we just encom- uh, encompass so many different kinds of climates here in the United States, from the frigid permafrost of Alaska down to the tropical kind of areas of Florida. Um, the kinds of trees that have really done well, have there been many that have been kind of imported and naturalized in the UK over the last several years?
for sure. And I mean, for the last 200 or 300 years, people have been bringing back trees and celebrating them as ornamentals in their country estates, um,
Uh,
from the fruit trees and kept in warm places and kitchen gardens with stone walls warmed with coal fires and the like, right through to other ornamentals such as magnolias and so on. Asia as well as both North America and Asia have been sources of those introductions. Nowadays, it's very easy to find a ginkgo tree in this country because they're used as street trees. They're so tolerant of pollution and poor soils. And this is another tree that has actually been researched quite well and shown to have anti-inflammatory effects in the body. So it's interesting that many introductions go back quite a few hundred years, ranging through, for example, the sweet chestnut, which has tannin-rich leaves that can be used for coughs, as well as obviously harvesting the chestnuts, is just one example. The horse chestnut is another introduction, but that one perhaps has only been used more externally. Again, there's research to support the use of the horse chestnut extract on the skin for varicose vein problems. So the constituents have been shown to help strengthen the blood vessels. Right. So the question of scale, I think, is one that's yet to be developed. I think there's more potential. I'd love to see more people using the hawthorn hedges, for example, which would be there in large numbers to supply. That there is an increasing demand, as I understand it, for hawthorn berry, whether dried or in tincture.
So which were some of those species in your own forest that you put effort into propagating and bringing on?
So we've mentioned a few, certainly the hawthorn and the ginkgo, the circulatory ones, and related to that, one that I brought from, if you like, the States, which was the prickly ash. So I was quite interested in an alternative circulatory stimulant. There are Mediterranean shrubs that can be used as circulatory stimulants, like rosemary, for example, which will grow in sunny and sheltered spots particularly well. And English rosemary is very aromatic. It's lovely when it's grown here. But so we tended to I almost take more care, if you like, for the introductions like prickly ash, which is the one that we had was Xanthoxylum americanum. That's quite a lot of interest in the pepper family, because of course they're all members of the rue family, the Rutaceae, and there are other Xanthoxylum species that are grown here, the Szechuan pepper, for example.
Well, I've got, I don't know, several tons I could send you if you want. Yes, it grows like crazy here and is considered an invasive that must be cut down. But we allow it to flourish on our farm because I use that as part of my herbal guide walks and as part of these samples that people can begin to work with in making infusions for the circular to improve and promote circulation, capillary circulation. So you brought in prickly ash. You've mentioned hawthorn a number of times, and the willows. Any specific type of willow that you focused on?
Well, willow is quite a vigorous plant here, so it's often pollarded. You'll see it along the Somerset levels where there's a lot of water, doing very well, and white willow is pollarded back, and they grow lots of basket willows. But we were interested in willows that were rich in salicin because of the anti-inflammatory effects, and we sort of investigated that bit and found that the willows with darker stems tended to be stronger, literally stronger in the key constituents. So purple willow, violet willow, they are European species that we were growing here, and they turned out to be much more manageable. White willow is, if you don't keep pollarding it, then it will grow into a massive tree.
Right.
Very difficult to manage when it gets to that kind of size.
Yeah, they can become just huge. We have them here. We live in a rural farm country, so we have them along the ditches, sometimes along the roadsides, and they're just huge. they're just massive, massive trees.
Yes, plenty of bark there. But again, this is another one that's well researched for its constituents, although not so many examples of clinical studies. And in fact, as I was putting together my book on medicinal trees and shrubs, the one that's called Trees and Shrubs That Heal, I did gather together a lot of references to scientific studies, a lot of them in the laboratory, analysis of ingredients, but some of them were clinical studies themselves. And that's available now. There wasn't space. It was 40 pages long list of references for 80 species, and there wasn't space to include that in the book. So that's now available. I've put it in on our website, the Medicinal Forest Garden Trust website. I put a download of those references. So if anybody's interested in any of those 80 species, they're very welcome to download the list. I wouldn't recommend it as bedtime reading.
Well, that's what I really value so highly in your books. Not only are they very readable, approachable, but they're so highly footnoted, and they cite so much research, which I think helps me. I mean, that's something that's important to me as I study, that that I can see that these kinds of research has been done. Because, to be honest, when someone asks me questions about herbs, very often they're very skeptical. And to be able to say, well, not only has this been used for generations as a remedy, but it also has been confirmed through research. And again, as you had mentioned earlier, Anne, there's not a lot of incentive for big pharmaceutical companies or labs to do any of this research because they can't patent it.
That's right. And I think it's really important that people know that there are monographs out there about these plants. There is a lot of detailed information. And the monographs, the herb monographs, are used by herbal practitioners when they're training, so that herbal practitioners in this country who are members of a professional body, there are several professional bodies. National Institute of Medical Herbalists is probably the largest, and I'm a member of the College of Practitioners of Phytotherapy, and there are several others. So anybody who is on the register of one of those professional bodies will have studied herbs in possibly for 3 or 4 years or longer as a starter. That's not to say they won't carry on, and they will have a good understanding of the medical side, clinical diagnostics and pathophysiology, so that they will have an understanding of how the active constituents might interact with others, including with medication that's been prescribed. So that's where, if somebody has an ongoing or serious complaint or chronic problem, that it's possibly worth their while consulting with someone who has got that information.
Mm-hmm.
And very often those practitioners will also prescribe tinctures at a much more reasonable price than you would pay for them in the shops, and you'll get a personalized prescription rather than an individual plant that may or may not be the right one.
One for you. So as we finish up this conversation, and what is it? How would you describe the state of the herbal medicinal practice in the UK right now? Is it growing? Is it at a plateau? Is it changing in any ways?
So it's really interesting what's happening here in this country. There are some very wonderful people who are spending a lot of time kind of coordinating and organizing online. So there's a lot more information online. And there are links also between the Western herbal medicine practitioners like myself, who might use a variety of plant species, and the more traditional systems such as the Ayurvedic system or traditional Chinese medicine systems. So there's quite a few overlaps and a lot of cooperation, and there's also a lot of celebration. So there are quite a few. I have an Instagram account, and I often see people just enjoying themselves, and events, festivals, walks, and talks, and so on, which is wonderful to see that there's still a growing interest. And of course, my interest is to try and join up the dots and say, well, also we can plant these these ornamentals, these natives, we can plant them in our gardens, our allotments, and so on, and actually use them, which is very promising. So I think the word is spreading, which is great.
I'm so glad we can look forward to a series of conversations with Anne over the next several months. She'll be looking at the trees and shrubs of North America as well as those of England. We'll also talk about plants that are at risk, either because of overharvesting or because of environmental changes. She'll talk about how to use these plants safely. That's something all of us have to consider. And she'll take a look at the history of using these wonderful plants over the centuries. Please go to my YouTube channel for additional show notes and for a link to Anne's newsletter. Also be on the lookout for her books: The Medicinal Forest Garden Handbook, Trees and Shrubs That Heal, and Household Medicine in 17th Century England. Until next time, discover the amazing world of healthful plants wherever you live.